Today, it's my honor to introduce Dr. Daniel Eisenberg, who will talk about investing in youth mental health at a population scale. Last year, the US Surgeon General called mental health in youth an emergency state. In the last 15 years, the number of young people reporting suicidal thoughts, depressive and anxiety symptoms increased dramatically. COVID-19 made things even worse with isolation and disrupted routines. What should we do about this at a college, community, state level? There are so many solutions available, from hiring more campus school counselors, expanding health insurance coverage, more training to faculty and students, to incorporating teaching coping skills in our curriculum. The problem, however, is we cannot have it all. College and state budgets are limited. So how do we know what programs we should invest in? How do we know which one has the biggest impact? Economics is all about answering those questions. Economics provides tools and a framework to evaluate different options and select the best use of our limited resources. For almost 20 years, Dr. Eisenberg has been applying his economics training to evaluate different options and help public policymakers, college administrators to select the most effective and efficient ones. He is one of the top experts in this field. Dr. Eisenberg is a professor of health policy and management in the Fielding School of Public Health at the University of California, Los Angeles. He has a PhD in economics from Stanford University. In 2005, he founded Healthy Minds Network, a research center that to date conducted surveys of student mental health already at more than 500 colleges. I encourage all of you to check the network's website, healthymindsnetwork.org, and specifically the materials of their annual symposia. It contains vast resources for student advocacy, faculty, college administrators, and parents. Dr. Eisenberg has over 100 published research papers under his belt, and most recently finished a book called Investment in Children's Mental Health. His recent research topics include using mobile technology and cognitive behavioral therapy to reduce mental health disorders in college students, depression among student athletes and ways to promote coping skills, inequities in access to mental health resources among college students of color, transgender, and gender-diverse youth. Please welcome Dr. Daniel Eisenberg.
Hi, good afternoon. Thank you so much for the wonderful introduction. And I could spend my 30 minutes actually thanking all of the wonderful people who have made this a unique experience for me. I think in my other co-speakers here, really everyone here, I've learned a lot from you all, my fellow speakers and the hosts, and actually a lot about the Gustavus as an institution. It's the kind of place where I hope my daughters, who are now 13 and 11, can go in the future for college. So, although as Professor Faychuk just described, a lot of my research has focused on college student mental health, I actually decided to do my talk on actually a different topic. So I hope that doesn't disappoint anyone, but I am happy in the discussion to talk about the student mental health side of my research, but I thought what might be more helpful for this kind of very broad discussion is to focus more on my perspective as an economist and this book project, which is really about kind of an economic perspective and a policy perspective on youth mental health. So I think I just want to first kind of make the case for why this is such an important topic and why an economic perspective and a public health perspective are useful. I probably don't need to do a lot of convincing, so maybe think of this as more, for this audience, maybe think of this as more as kind of ideas for making the case yourself, as if you're already on board with this case. Public health, of course, is dealing with all kinds of massive challenges. Healthcare costs, our healthcare system in the US, which seems to be quite inefficient in many ways, the opioid epidemic, gun control, gun violence, obviously the pandemic and other pandemics potentially in the future. But I would argue that youth mental health is right up there in that first tier of most important public health issues. And so let me explain why. First of all, there's a high prevalence of mental health conditions among children and youth, not just in the US, but pretty much any country where we've had epidemiological studies of youth mental health. In the US, it seems there's approximately 1 out of 5 children, about 20%, who meet criteria for what would be considered a severe or serious emotional disorder with significant functional impairment. And worldwide, the World Health Organization, World Bank have done a project called the Global Burden of Disease Project, where they've tried to quantify what's the overall burden of disease for different types of disease, different parts of the world, different age groups. And for young people, where I'm defining that as 0 to 24, although all of us are young at heart, but children, adolescents, and young adults in the US and many other countries, mental health conditions together comprise the highest burden of disease, the highest category of disease. So I'm going to share a little bit of data. This is actually maybe the only data chart that I have from our student mental health research, but this is from the Healthy Mind Study, which was just briefly mentioned. This is a national sample of colleges and universities where we're doing a representative sample web-based survey over the years. And one thing that we've seen, first of all, is that there's been, as you've already heard in this conference, a steady rise in various aspects of psychological distress. And in this chart, it's depressive symptoms, but it would be similar if I showed you anxiety or suicidal thoughts. Also, we're seeing persistent inequities across different dimensions. In this chart, I'm showing across different gender identities, but I could show you similar types of inequities across different lines if we had more time. So that's one reason why it's such an important topic. Another important topic, kind of from a more positive perspective, is that there's such an opportunity to have an impact. And so in 2009, for example, the Institute of Medicine produced a report on prevention of mental and emotional and behavioral disorders among young people, and I had an opportunity to contribute a little piece to that report, which was an estimate of the overall economic costs of these conditions among young people in the US. It's a very rough estimate based on a lot of assumptions, but we approximated that it's on the order of $240 billion of economic costs. And I won't get into the details of where that number comes from. I know it might seem a little mysterious, but it's significant for society from that perspective as well. Another reason why it's such an important topic, also such an interesting and complicated topic, is that for children and youth, and really for any age group, mental health cuts across so many different sectors of our society and so many different types of service. So there's a concept called system of care that became popular in the US in the 1990s and since then. And the idea is that we need to better integrate our approach to supporting youth and children mental health across not just mental health services, but also social services, educational services, substance use, vocational, juvenile justice, school, special education. There's just, mental health touches everything, and it's affected by everything that's important in our lives, and therefore it's complicated to deal with, but it's also kind of a great opportunity because there's so many different ways we can make a difference, as we've already been talking about in this conference. So the way that I think about this topic as an economist is, and what really got me interested in this topic to begin with, is the idea that we probably can make some really good investments. As Professor Fejchuk just described, we don't have enough resources to do everything we want to do with respect to youth mental health. So we need to make hard choices. We need to allocate our scarce resources and our scarce time, and that's what economics can help think about. And so for me, kind of the questions that I want to try to help answer, and sort of the way our book is organized, is first of all, what are the best investments from from the limited data that we have? Lots of caveats in the book. And then, to what extent are we actually making those investments? Our focus is the US in this book. And then, given that there is, in fact, as you might guess, and as we've been talking about, there is a large gap between what seems to be the best investments, the best approaches, and what we're actually doing, how can we do better? How can we close that gap? That's what we try. We're just trying to, first of all, state these questions explicitly and at least provide a starting point for answering them. Certainly, we don't have the definitive answer. You can't just read our book and then solve all these issues, unfortunately, as you might have guessed. Oops, wrong button. So this is my co-author, Ramesh Raghavan, who's at NYU. He's been wonderful to work with, so I want to give him credit and a little bit of screen time with this wonderful audience. And our book should be coming out in Oxford University Press, hopefully later this year, but although I've learned it's my first book that everything, it's kind of like maybe home renovations, everything takes longer than your whatever estimate you or someone else might tell you. So first of all, as I like to tell my students, especially my PhD students who are doing research, first of all, take a step back. What's the conceptual framework? What's the theoretical framework? Before we get into data and data analysis, what are we even talking about? And let's kind of name some of our assumptions. So first of all, what do I mean by investing in children's mental health? That could mean a lot of different things. And first of all, what is mental health? One definition that I like is from the World Health Organization, where you can read it here, but basically it's a holistic definition. It's not just about mental disorders, not just about psychological distress, but it's also about realizing one's potential, coping with normal stressors of life, working productively and fruitfully, able to make a contribution. So it's a lot bigger than just a mood, and it's a lot bigger than kind of deficits. Next, what do we mean by investments? So economics has, of course, a lot to say about this, and to be clear, I'm an economist, but sort of. I'm in a school of public health, and I certainly have strayed far from the canon of economics in some ways, so I'm very open, I think, about the limitations of economics and really enjoy working with psychologists, communication experts, sociologists, the kind of types of perspectives that we've been hearing from as well here. But first of all, economics has a health and human capital framework where we think about, as people, we have certain assets that are important to us, our health, and our human capital refers to our skill and our knowledge, basically, that kind of help us in the workforce and employment. That's traditional economic frameworks that are, I think, somewhat useful here. And we can similarly think of our mental health as a key component of our health. That's an asset that we need to nurture, and not just as individuals, but as a society, as we've been talking about. And then also economics has a framework for evaluating comparing different alternatives, strategies, cost-benefit analysis. Probably most of you have heard of that, but I'll say a little bit more about that. So more broadly, there's economic evaluation is sort of an umbrella term for not just benefit cost analysis, but a whole kind of family of methodologies that they all basically have the purpose of trying to quantify what do we get for the use of our limited resources. So the costs are basically not just financial costs, but the human costs, the time costs of actually implementing a strategy. That's what we're giving up, in a sense, from an economic point of view. And what do we get? What are the benefits? And can we quantify that? Again, lots of assumptions, lots of limitations to actually quantify things as complicated as mental health and health. But the basic, so lots of limitations, but I would say the reason why I find these still compelling frameworks is I think we have to at least try to quantify. If we don't even try, if we don't try to put numbers to it and then be very open about our limitations, then I think we're kind of in a world where we're going not just on gut instinct, and we're going on maybe kind of whose voice is louder, So this is sort of an objective system for considering alternatives. Plenty of limitations, again, that we can talk about, but it's a useful starting point. So now, in terms of thinking about a framework, we're thinking about, well, what potential strategies should we consider? I want to just note that I think there's a thread that's been common through maybe all of our presentations so far, and I'm guessing that my friend Professor Joe Gahn is also going to have this thread in his talk when he goes next. But basically, that we need to think above the individual level or outside of just the individual level. And the social ecological model is kind of the classic that was already shown in a previous presentation, where there's the individual, interpersonal, but also organizational, community, and policy levels that we need to think about when we think about strategies for improving youth mental health. Also, which maybe we talked less about, there's a developmental framework we have to consider. The fact that children, of course, grow and mature, and their needs and their assets and their strengths and limitations evolve quickly over time. So we need to think about whether our various approaches that we have are matched appropriately to the developmental stage of the young people who are experiencing those strategies. And then I find very compelling when we think more specifically about frameworks for thinking about youth mental health, the nurturing environments framework, which I think has a lot of parallels of what we've been talking about. The idea, one of the most compelling ideas in this book and this framework, on the what is that, the right side of the screen for you as well as me, is that we tend to address issues like, say, substance use and violence and mental health and, say, education. We tend to think we have separate agencies and separate strategies, separate approaches, but in fact there is, again, a common thread that is supportive for young people, and it's what they call a nurturing environment, and they spell out kind of what does that mean. But I think really what we've been talking about a lot here is that social relationships, social support, the social environment is so fundamental to young person's mental health and to older person's mental health as well. Now turning to, again, how do we choose the best strategies, the best investments? I do think we have to look at evidence. And I know we've already talked some about the limitations of evidence and the fact that sometimes evidence is created in a context that does not necessarily apply to a different context. So we have to be humble in our interpretation of evidence, but we still need, and we need to build the evidence base. We need to build it so that it's more representative, more diverse, more appropriate. We need to adapt interventions, new interventions. We need to ask communities for interventions. All that said, I think what we don't want to do is throw up our hands and say it's impossible to get all the evidence that we need to make informed decisions. That I think it's tempting sometimes because it is so complicated to get evidence that really fits for the context that we're trying to make decisions about. And in fact, I think in the US and federal policy making, at least during the Obama administration, for example, there was a move towards a greater use of evidence in policy making. For example, as part of the Affordable Care Act, there was a serious investment in home visiting programs especially low-income families with newborns and with various other risk factors. And the idea is that a nurse or another trained professional, or even a peer sometimes, can visit a family periodically and help support a more kind of nurturing environment for a child at the beginning weeks and months of life. And that policy came along with some stipulations that we need to be investing in programs that have evidence, because there are programs that have evidence. We also need to build the evidence for programs that have maybe promising but not definitive evidence. I also want to just point to you another resource out there that I think is worth looking at in the future is what are called registries, or sometimes called clearinghouses or repositories of evidence-based programs. Some of you might be familiar with these. In the context of youth mental health, I think one of the most useful registries is called the Blueprints Programs for Healthy Youth Development. It's based at University of Colorado, and they have a large database of basically social and health-related programs that support youth development and mental health, and they rate the evidence. They put the programs or interventions in different tiers, like model is the highest tier, and there's very few in that tier, promising, and then well, actually just model and promising. There's model plus, I think, is kind of even a more select group. And they have very high standards for what to be a model program. I think that's useful if you want to really kind of hone in on the programs that have the most substantial evidence. They also have a lot of information about, well, this evidence, who is it created for and with, what groups, what were the demographic characteristics of the evaluation studies, for example, were there differential effects by different groups? So I think to some extent it gets at some of those issues, but we have a long ways to go in that respect. Another great resource is the Washington State Institute for Public Policy, especially in terms of economics. So they basically, they provide benefit cost results for a large number of social and health programs, I think not just for young people, also for older age groups as well. And they actually work, their mission is to inform the the state of Washington legislature so that they make better policy decisions with their limited resources. So they have benefit cost estimates for a wide variety of social and health programs. Okay, so just to kind of summarize what the second question that I posed for our book, now they talked a little bit about what are the best investments, what might they look like, is, well, how well does current practice in the US line up with that evidence? First of all, that's really hard to say because unfortunately there's a lack of comprehensive information about what we're actually doing in the US to support student mental health, or our youth mental health, I'm sorry. Because again, first of all, because mental health interventions are cut across so many different sectors, so many different types of approach, so it's kind of hard. You can't just look at one kind of sector or one agency and say, okay, what are they doing? What are they doing in Minnesota? It cuts across too many boundaries. And so I think, first of all, we need to do a better job of actually documenting what are we doing in terms of particularly not just clinical services, more importantly, kind of community-based, community-level, public health level approaches to youth mental health. We need to know more about what we're actually doing. But with the limited information that we do have, I think we can confidently say that there's a huge gap between what we're doing and what the evidence says we probably should be doing. And so just to take a couple examples, and I'll talk more about the SEL, social emotional learning programs in schools. That's been a kind of a fad or a trend in the last 20 to 30 years in the US. And some of these programs actually have good evidence that they're supportive of youth social and emotional development, but the ones with the best evidence are being used in less than 5% of schools. So we're not actually implementing that evidence on a large scale. Similarly, with substance use prevention, some of you probably remember the DARE program, Drug Awareness and Resistance Education, which actually was the most widespread substance use prevention program in the US for a long time, and actually turned out to have very poor evidence once we actually evaluated it rigorously. And still today, or in recent years, it's only about a quarter of schools nationwide that seem to be using the programs with the best evidence of actually reducing substance use. And lastly, adolescents with severe behavioral concerns. These are often adolescents who are at risk or already in contact with the juvenile justice system. We tend to take a very punitive approach. We have a very kind of institutional approach, as I think many of you know. We tend to prosecute these young people. We tend to put them in residential treatment centers. We tend to remove them from the community where they actually might receive some support from their family and their friends. And less than 10% appear to be getting what I think would be appropriate services based on the evidence that really more therapeutic, systemic approaches are what work best. So why is this the case? Why is there such a gap between what the evidence suggests we probably should be doing and what we're actually doing? I'm sure many of you have great ideas on this. We've talked already about some of these things, but just to kind of summarize in 30 seconds, some of the major categories of barriers, there's organizational factors, of course, the leadership for many organizations and policymakers. They may not have the attitudes or knowledge or the structure or the incentives that actually align up with using the evidence for what's going to work best. Financial incentives don't tend, well, I just said before how we're so fragmented in terms of the agencies that support youth mental health, and therefore the money, on the public side, for example, the money is going in 10 different directions, And so no one organization or agency in a community actually has a financial incentive to invest in the evidence-based program because they're not going to benefit financially. They can't afford it because the finances are just spread across all these different groups. And then political constraints, of course. I think the basic problem there, as with many issues in public health, is that the best investments tend to be those who have longer-term rewards. We invest early in life, and then we get good outcomes for young people far into the future. But it's an upfront investment with a long-term payoff, and that doesn't line up very well with what politicians are faced with in their incentives. They need quick wins. They need immediate evidence of success. Their election cycles are much shorter than the cycles for these types of interventions. Okay, so our book, to make this big topic more manageable, our book goes through a series of case studies. It's just a selected set of studies intended to kind of capture different age ranges, different types of approaches, by no means intended to denote that these are the most best strategies above all or the only strategies. But here are the case studies that we go through in our book. First of all, we have a chapter on home visiting programs such as the nurse-family partnership. We have a chapter on parent training programs more broadly. Triple P is one example. And then we have a chapter about social emotional learning programs, which I just spoke about. And that's the one I'm going to get into more detail in just a moment. I only have time, I think, to go into detail for one of these case studies today, but also just want to highlight what else we're looking at. Multisystemic therapy is a kind of social ecological intensive intervention for adolescents who are often have behavioral issues that are that cause them to be at risk or in the juvenile justice system. And the whole idea there with MST is that let's as I think previous speakers have said, let's take the focus away from this being the child is the problem and think about the problem is what's surrounding the child, the community, the relationships, the system of support is not working for the child. And let's strengthen that, and let's look at the assets that are already in place and strengthen those. And then lastly, community-set care is kind of not a specific intervention, but it's actually kind of a whole framework for a community to come together, assess its own needs, and then make a plan for reducing youth substance use that tends to be the focus, and then maintaining that over time. So just quickly, I'll say a little bit more about SEL, social emotional learning programs. And I know some of you, if you've read about SEL in the news recently, you probably, I think actually maybe Lisa Heldke referred to this earlier yesterday about how it's getting kind of mixed up in the culture wars, so to speak, or the political wars about what are we teaching our young people. And so unfortunately, SEL has now become a politically divisive term, even though it really does not need to be. And I think you'll agree when I kind of tell you more about it. So what it is the idea that it's in schools. It's not just, I think primarily this has been done at the primary level, elementary level, but also secondary schools as well, and even higher education has SEL components to it. The idea is that we shouldn't just be teaching math and science and so on, but actually we should be supporting the social and emotional development of children. That's not a new idea. I think any of you who is an educator has probably always appreciated that fact, that as educators, we're mentors, we should be role models, not just for how to compute a really complicated algorithm, but how to actually make our way through life. But SEL is trying to say, okay, let's explicitly do that with a formal approach, and it has various components to it. Self-awareness, recognizing our feelings as children, being aware of our emotions, then having ways of managing those difficult emotions particularly, and then making responsible decisions. That comes into play, I think, more as you get into adolescence. Also awareness, so that's not just about my feelings and how I'm feeling as a child, but actually how do my peers feel? How are they reacting? And then in turn, kind of how can we develop our relationship skills? So there's many dimensions to SEL, and I don't mean to imply this is a panacea for young people and mental health. It's just, I think, one approach that can be helpful. And there is quite a bit of evidence now. There's hundreds of studies, a lot of randomized trials, and actually quite a diverse set of communities and populations that are consistently showing not massive effects. Because you think of this as a pretty light intervention, and it doesn't cost that much. It's sort of it's done often at the school level or classroom level, but small to medium effects in kind of effect size terminology. There are major limitations to this research that we need to continue to push on. The outcome measures are often subjective. It's often the teachers or parents' report of how the child's social and emotional development, which is, can have its biases. And also there's limited follow-up. It rarely goes beyond 1 year, if that, in a lot of these studies. So we don't know necessarily whether these are lasting impacts. The economic evidence also looks favorable for some of these programs. Positive Action is one example of a program, and PATHS, that's a long acronym, is another program that seems to have strong effectiveness and cost-benefit evidence. However, as I've said before, there's a gap between what seems to work and what we're actually doing. Some of the model programs like PATHS and Positive Action are being used, as I said before, in less than 5% of schools. Many districts have no program at all. Although I haven't seen definitive data on this, I'm quite sure that there is a socioeconomic disparity in terms of which school districts have more robust programs, because it doesn't require a lot of funding, but it requires some funding. And also, I think a lot of school districts are dealing with what they probably rightly view as more pressing issues than implementing a new SEL program. Implementation also is often weak, so there might be a program in name, but in practice, it's not really being used intensively enough to have an impact. And I had the opportunity to visit. I'm not a qualitative researcher, and I'm in great admiration of some of the qualitative research that we've heard so far, but I did have an opportunity to dabble by visiting the Cleveland School District, and which was pointed to me by one of the national SEL experts as a model of success in some respects for implementing SEL effectively. And so they were really nice in showing me around their district, allowing me to sit in a couple of classrooms at a couple different schools. One of the schools was 100% black students. The other school was predominantly Latinx students, and those were two of the schools that were, according to the administrators there, and actually and based on my own observation, were most successfully implementing SEL in Cleveland. But there are major limitations. It's hard to fit it into the school curriculum. It's hard to train teachers and other professionals sufficiently to actually implement it. And there's a lot of turnover, as you know, in schools and district leadership. So you might get an SEL program off the ground, and then the principal leaves, and then you kind of have to start all over. And funding is not insurmountable. It's not a huge amount of funding, but it is not trivial either. So there's a lot of currents that need to be that we're swimming against. One kind of potential solution to this issue that it's hard to fit into the curriculum, which I wanted to point out, it's also a broader concept, not just for SEL, called a Kernel approach. I don't know if anybody's come across that, but I was really compelled from the moment I first read about this. The idea is that when we think about interventions and programs, let's not just think about these like kind of big package standardized programs like a whole curriculum that goes over a whole year, but let's also think about like little kind of micro practices that are beneficial, that we can sort of sprinkle in skillfully and flexibly, and actually allow teachers to decide how to like kind of mix it in to their school day, or allow principals to help figure out how can we mix it into the whole school experience. So they're kind of like like for example, in the PATHS program, they have a lot of these little kernels within them, and one of them is called the turtle technique, which is essentially to think of a turtle as sort of a visual aid or a metaphor for when you're experiencing really difficult emotions as a child, but really maybe any of us could do this. And you first of all, one thing you could do is kind of go into your shell, not in a bad way, but to kind of retreat and allow yourself to process that emotion, identify that emotion. You're hurt, you're angry, you're surprised, you feel let down, and identify that emotion, and then kind of have a moment to think about, well, what do I do with that emotion? and what would be a behavior then or a response that's going to be productive for myself and is going to maybe not escalate the situation with my peers. So that kind of technique can be taught to young people actually pretty quickly, and then there are ways you can kind of weave it into the day rather than having like a whole laborious curriculum, which is hard when you're competing with other priorities in schools. Okay, so to summarize with SEL, I'd say it's a promising investment. There's still lots of things that we need to learn. Exciting opportunities for growth, since only less than 5% of schools are actually doing what seems to be work best based on what we currently know. And so the research needs to learn more about the long-term investments and needs to learn more about actually objective outcomes and also more about the mechanisms, the active ingredients for the intervention, what actually makes those interventions effective. And that's going to help also when we try to adapt the approach to various other settings where we don't already have great evidence. We sort of know at least what are the active ingredients, what's kind of adaptable. Okay, so lastly, just a few quick broad conclusions I'll offer you based on our review is that there are several program services with quite strong evidence. Not a lot. I mean, still probably a tiny fraction, but it's still a good number of programs and services for youth mental health that have strong evidence, and we're not investing, I'd say, nearly enough in those programs, number one. Number two, there's a much greater number of programs and services and approaches that have promising evidence, but still a lot of uncertainty about that evidence. So it's kind of in an intermediate phase where we need to not just prioritize those that already have more definitive evidence, but actually we need to experiment. We need to then evaluate rigorously the outcomes when we do implement these promising programs and resolve some of those uncertainties. Third, I think sometimes there's a debate in the child development world about what age we should focus on, and often people will say the earlier the better, so let's really focus on infant mental health and infant development. But I think, as probably you would all agree, there's no one silver bullet, and we need to consider a diverse set of strategies that kind of build on each other. Scaffolding is a buzzword that I often hear. Scaffolding of our approaches over the developmental stages of young people, not just like a great intervention in toddlerhood or infancy, and then that's it. Next, there's some major barriers that are limiting the reach of best investments, as I've talked about, the fragmentation, but we have examples of success. We have states, we have communities that have overcome these barriers, so let's learn from that and let's address these barriers head on. And lastly, many of these investments, I didn't really have time to go into the details, but many of these investments are strong, not just from a benefit cost point of view, but also from an equity perspective. And more specifically, what I mean is that many of the strongest economic investments are also the ones that are targeted or that actually are most effective and tend to benefit the most disadvantaged families. Like home visiting tends to focus on lower income communities, lower income families, and in fact has gotten the best results with those families. I'm saying that as a universal truth because there's definitely some exceptions where we have evidence, we don't have enough evidence, I think, to say that this actually is a program that's going to help with equity, but I think we do have some examples at least. These are just some discussion questions that we don't need to dwell on here, but just if any of you are maybe educators and want to kind of go further with this topic and want to talk about it more with students or other people, these are some of the things I would just suggest you could kind of go on further with. And then lastly, my contact information. I've had a Twitter account for 8 years. I made my first tweet like 2 days ago. So this is my first time ever sharing my Twitter handle, because now maybe, I'll think my next tweet maybe will come another 8 years, but I'll still be thinking very hard about what it's going to be. But maybe if I get a couple followers, then maybe I'll actually I'll pick up the pace. Thank you so much.